Good afternoon. My name is Lata, Reddy, and I lead Inclusive Solutions at Prudential Financial. My colleagues and I spend a lot of time thinking about how we build resiliency and equity into financial wellness. So I want to thank the Financial Health Network for allowing me this opportunity to share a few thoughts on this topic. We've seen how even in the best of times, financial security is still out of reach for too many Americans. COVID-19 and the most recent tragic killings of Black men, women, and children has laid bare the inequities and systemic racism that have always existed, but were out of sight to many. We as a society are faced with a moment of reckoning and a need to make real change. For business, the imperative is clear. Inequity is our greatest disruptor. Prudential's understanding of that was forged in the crucible of Newark, New Jersey, one of our country's oldest and most diverse cities. Many people are surprised to learn that Prudential was founded in Newark 145 years ago, and that the city remains our global headquarters. For 6 days in 1967, Newark's residents rebelled against racial disparities in policing, unequal access to resources and opportunities, and civic disenfranchisement. That moment cemented our belief that our company's success and our community's success are inextricably linked. And earlier this month, as we saw protests return to our city, we were reminded of how far we as a society have to go. Like in many cities across the country, COVID-19 has tested the resilience of Newark's families and small businesses with a disproportionate negative impact on citizens who already faced entrenched barriers to opportunity. But in recent years, once seemingly immovable problems have begun to shift. Crime rates are down, high school graduation rates are up, neighborhoods are vibrant, artistry abounds, and fast-growing companies are moving in. We've learned a lot through our cross-sector work in Newark over the past 40 years, namely that building resiliency is a ground game, and it's certainly a long game. We've learned other things as well, ideas that are showing promise in Newark and are applicable in other communities. First, as was just discussed, emergency savings is a critical component of resiliency. 63% of Americans don't have enough savings to meet a $500 emergency. In Newark, Black households are on average 3 times as likely than white households to be liquid asset poor, meaning they lack the savings necessary to live above the poverty level for just 3 months if they lose a job, face a medical crisis, or suffer an income disruption or emergency. Prudential collaborated with our partner, Prosperity Now, to design an after-tax, payroll-contributed in-plan emergency savings feature that offers workers a new way to save for retirement, but still have access to their money in case of an emergency. Thousands of people are now making contributions to their after-tax emergency savings feature through this solution. Second, we need to systematically remove barriers to asset building. When financial services organizations aren't meeting the community's needs, it creates obstacles for households and entrepreneurs to build financial security. Seeing this chronic problem in Newark, we came together with local nonprofits, government officials, and other corporations to create the Newark Asset Building Coalition. The coalition offers programs like Newark Tax Prep, which have helped residents receive millions of dollars in refunds and save substantially in tax preparation fees. The coalition also offers financial coaching, small business services, and other wealth building programs. Third, offer paid family and medical leave to all workers. Prudential, which has long provided paid leave programs to its own employees, is a champion of a permanent, comprehensive national solution for providing paid family and medical leave to all workers. The COVID-19 pandemic has made it clear that when more than half of U.S. workers cannot afford to stay home when they're sick, all Americans' health and financial stability is at risk. Right now, only 1/3 of the lowest private sector workers have access to paid leave, compared to 93% of the highest paid workers. Black and Latino workers are less likely than white or Asian American workers to have any leave benefits at all. To be resilient, they need them. Fourth, increase awareness and participation in workplace retirement plans. Employer-sponsored retirement savings plans are the bedrock of the U.S. private retirement system, and small businesses, unfortunately, haven't been able to easily offer this benefit to their workers. The groundbreaking Secure Act changed that. Passed in 2019, the legislation, among other things, increased access to retirement plans for small business workers through open multiple employer plans, or MEPs. MEPs can dramatically open up access to retirement savings, particularly for women and people of color who make up the majority of small business workers, and make it easier for them to convert savings to guaranteed retirement income that cannot be outlived, thereby creating greater resiliency. And finally, and fifth, lay a strong foundation of core services, things like housing, education, and access to technology. Homeownership builds stability and dignity, and a robust real estate sector with housing at a range of price points is a tried and true economic engine and wealth building engine. Quality public schools are critical to moving up the economic ladder. Communities need a portfolio of options for quality education. And our national digital divide remains a pressing social justice issue. We all know that recovery takes time, shared values, and co-creation across sectors. Sustainable, scalable solutions require investing in those cross-sector partnerships. So we must challenge ourselves to ask, not just what more we can do to be part of the solution, but what is the maximum we can do? How can we move beyond simply coordinating efforts to progress to true collaboration on sustainable systemic pathways? It's a privilege to have spent this time with you today and to be in partnership and collaboration with the Financial Health Network and with all of you to carry these questions into the world, to figure out how together we can create a more just, equitable, and resilient society. Thank you.